Hello and welcome. My name is Cheryl Vercamman. I'm the Mayor of Marine City, and this is another segment of the Mayor Minute. Today, I will be interviewing Ken Cummings, who is the CEO of Tri-Hospital EMS, which is our local ambulance service in St. Clair County. Welcome, Ken.
Thank you, Cheryl. It's great to be with you.
Thank you. I appreciate you being here. I always like to start off the interviews by asking the simple question of, tell us about yourself, what kind of background you have, education, that kind of stuff.
Sure. Appreciate that. Again, my name is Ken Cummings. I'm the President and CEO of Tri-Hospital EMS. I have actually spent myself the last 44 years, it'll be 44 years actually in April, in EMS. I am a licensed paramedic here in the state of Michigan. I've been licensed as a paramedic since 1986. Prior to that, I was licensed as an EMT. But I took over the reins as the president and CEO of Tri-Hospital EMS in 1987, and I've served in that capacity since that time. So I've really enjoyed it. It's been a great career and a great organization to be a part of. I am a lifelong resident of St. Clair County. I was born in St. Clair County, and it's been a great privilege to be able to work in the community in which I grew up in.
Mm-hmm. Good. So who is Tri-Hospital EMS? What services do you provide to our community?
As you said in your opening, we are the ambulance service for most of St. Clair County. Tri-Hospital EMS, the corporation itself, was actually formed and created in 1983. We are a joint venture partnership that was created by our three local hospitals. Back in those days, it was Port Huron Hospital, St. Joseph Mercy, which is now Lake Huron Medical Center, and then, of course, Ascension River District. And so those are technically the three owners of the corporation, but we do operate as a separate, freestanding, not-for-profit corporation governed by those three hospitals. But we do provide, as I said, we provide ambulance service, both emergency and non-emergency ambulance service to the citizens of St. Clair County. We also provide a number of educational programs, CPR, medical training, things of that nature that we offer to not only our employees but also to the public as well. And then we also offer a couple of other services, one being a wheelchair van transportation service for individuals that don't require medical personnel to accompany them in the back of a vehicle. But may not be physically capable of ambulating into a vehicle or whatever. And so we provide a wheelchair van with a lift, a power lift, and are able to take them from various points of location to appointments or perhaps even shopping or whatever needs they might have. So that's a service that is utilized a great deal throughout the community as well. And then the final thing that we offer, or we do, is we also operate an answering service. We are, of course, a 24-hour operation because we're an ambulance service, and so we began about 15, 16 years ago, we began answering telephones for physician practices after hours. We had a number of physicians that had come to us and asked if we could answer their phones for them when their offices close. And so we looked at it and put together a program, and we've been doing that now. We have about 100 clients, and we actually now answer the switchboards for two of our three local hospitals, McLaren Port Huron and Lake Huron Medical Center. Both of those switchboards are actually answered in our office by our staff at Tri-Hospital EMS. So we do provide a number of things, but again, our primary core business is we provide ambulance service to the citizens of St. Clair County.
Mm-hmm. So when you say that you answer the phone for physicians in the area and stuff, so these are obviously calls, medical calls, correct? People with questions about their health and after hours?
Yeah, and I think that was one of the tie-ins that the physicians saw by coming to us and doing it. Obviously, we have medical personnel available. They thought that having one of their patients call that maybe was experiencing some type of medical symptoms, that it was a good tie-in to have the ambulance service answering those calls, because if during our assessment or conversation with the patient or the caller, we were able to determine that maybe they were having a medical emergency, in addition to notifying that physician of their patient's needs, we could also immediately dispatch an ambulance. And so there was really no delay in getting those services to the patients. And we've had that happen on a number of calls. Most of the calls we get are generally verifying an appointment for tomorrow or things of that nature, but occasionally we'll get someone that has an acute illness that will need immediate medical attention, and we're able to provide that through the ambulance side almost simultaneously. So.
And where is that call center located?
It's actually located at our main office, which is located in Port Huron, right near the county administration building and the county courthouse. We have an office that we have occupied and owned since 1994. And that is where our call center, our 24-hour communication center for dispatching of our ambulances, as well as all of our administrative services are located at that particular site.
And that obviously you have vehicles in there too, right? Because you can actually roll from there too, correct?
Correct. We actually have an ambulance stationed there 24 hours a day, 7 days a week, a crew that is there when they're not on calls. But in order to serve the county, again, if you're familiar with St. Clair County, we're a fairly long and narrow have a long and narrow corridor. And so we do have other stations located strategically throughout St. Clair County, in addition to the main office that we have in Port Huron. And each of those stations are staffed 24 hours a day, 7 days a week, with licensed personnel and an ambulance ready to serve.
Where are they located?
So they're spread out, as I said, pretty strategically throughout the county. We have actually a total of 9 locations. We have an ambulance at our main office in Port Huron. We have a second ambulance in Port Huron, which is located on the campus of Lake Huron Medical Center. We have a third ambulance located on the campus of Ascension River District in East China Township. We have a fourth ambulance located in Clay Township, adjacent to the Clay Township Fire Station. We have another ambulance, a fifth one, located in Ira Township, right on the Ira Township office campus as well, next to the Ira Township Fire Department. We have another one up in Fort Gratiot Township. We have another one in Kimball Township, and we have one located in the city of Yale, and then we have the final one is located in the village of Capac. So we're pretty spread out,
yeah.
But again, because we cover such a wide area geographically, in order to ensure that we provide good response times to any caller that is having a medical emergency, that's why we have those vehicles positioned in the locations that they're positioned in.
So how many how many vehicles do you have?
So we have equipped and licensed. We have a total of 18 ambulances. As I said, we do staff 9 of them 24 hours a day. So 24 hours a day, 7 days a week. There is always 9 ambulances staffed and equipped. Then on certain days, when we tend to have a little bit higher call volumes, we do staff additional units on top of that. So typically we run 11 trucks Monday through Friday, 11 ambulances staffed and equipped Monday through Friday during the daytime hours, because that's when we tend to see the higher call volumes. But all the time we always have at least 9 trucks on the road at all times.
And then how many employees does Tri have?
All total, combined with all of the different departments and services that we provide, we have about 120 employees that work for us. Clinical employees, which would be tied strictly to the ambulance, we have about 90 employees that are licensed clinical or clinicians that provide primarily the ambulance service.
And when you say clinicians, that's EMTs, paramedics?
Correct.
Yeah. Yeah. So how long has you answered this already? How long has Tri-Hospital been in business?
We've actually been in business on December the 12th, which is about 4 days from now. We will actually celebrate 38 years of service to the citizens of St. Clair County. So we've been here quite a while. and been very proud and honored to be able to serve the citizens of St. Clair County.
And you're right, St. Clair County is we're not a big box like Oakland County, you know?
Right.
We go from top to bottom. They always say that Fairhaven, Iowa Township is like the redheaded stepchild. I mean, they're
Yeah.
you know, so removed because of their location only, you know?
Yeah, and in fact, you know, we cover all the way to the north, which is up in Birchville Township, and Fisher Road is actually the county line between St. Clair and Sanilac County to the north. So we cover from Fisher Road all the way down to New Baltimore, including Harson's Island. And if you ever did the mileage, it's probably about 45 miles from one end to the other. So it's absolutely critical that we have ambulances stationed strategically throughout that service area so that we can provide good response times to people when they have a time of need.
Right, right. Speaking of time of need, when should a person call 911?
That is a great question. You know, I think anytime a person is experiencing symptoms that they're unfamiliar with, that you know may be causing them some difficulties in breathing, or if they're unable to you know, mediate the pain through some method, either some pain medication or perhaps moving the limb or the area which is affected. You know, I think that for years we have seen the demand for ambulance service increase, and certainly we want to make sure that the public knows that when you feel like there's something wrong with your body that's not normal, we would prefer that you call and let us come out and check you out. You don't have to go to the hospital. That's always your choice, whether you go to the hospital or not by ambulance. But I think that we would much rather see people err on the side of calling us if you think you're having a medical emergency. And part of the reason I say that, Cheryl, is because, you know, as consumers, we're somewhat, I guess we're the types of personalities that sometimes we deny that we're really having a problem, because we think, well, gosh, that wouldn't happen to me. I've got this pain in my chest, or I've got this numbness in my arm, or whatever that symptom might be. We tend to dismiss it and think that, well, you know, it's not really anything serious. And often, you know, what we would say to people is that those are your early warning signs. Those are the indicators you ought to be listening to and observing, and you really should be reacting when you start to feel those. Now, obviously, we don't want people calling, you know, 911 for an ambulance service when their condition is not perhaps life-threatening or something that you know could clearly be treated otherwise. But you know, really, if your symptoms are getting worse and you notice that they're progressing, you really should think about calling and let a medical professional come out, check you out. We can put you on a heart monitor. We can take your blood pressure. There's a number of things that we can do right there in your home and assess you and determine whether or not we think, based on what we're seeing, whether or not you need to go to the hospital for further follow-up type of care.
So just because someone calls 911 does not necessarily mean that they're going to get an ambulance ride to the hospital.
That's correct.
Right? I mean, if you're on scene and the person is maybe just having anxiety, right, little panic attack, you know, they feel like they're having a heart attack, but everything else, you know, that you're triaging them, the EKG, all that stuff comes out perfectly fine. You know, because I think that the general public thinks that once you make that phone call, you're going to get in an ambulance and go for a ride. Yeah,
and that's absolutely not correct at all. And I would emphasize to all of your listeners that, you know, it's always your right, whether you're transported to the hospital or whether you choose to seek medical treatment or not. That right always belongs to you. The only times in which we would you know, rely on what we call implied consent is if you're unconscious and you're not able to speak for yourself, then the law does certainly allow us to apply what's called an implied consent, which means that if you're unconscious, it appears you're having a medical condition, then we are really obligated by law to take you to a medical facility. Michigan laws really require us as a licensed ambulance provider in the state of Michigan. They require us to respond to every request. So we have to respond regardless of ability to pay or what the circumstances are. However, when we get there and we assess you, the decision whether to go to the hospital by ambulance always rests with the patient and the individual that's involved.
Yeah, because one of the things that I don't like to see is someone that calls 911 because obviously you're taking a critical truck off the road, and then somebody else is having a heart attack or a stroke or there's an accident, and you have a vehicle tied up for something that really isn't an emergency.
Yeah, we actually a great example of that today. We had some snow this morning, and with the snow comes slippery roads and comes cars sliding off into the ditch, and with so many people having cell phones, I think pretty much everybody has a cell phone today. On these types of mornings, we get a lot of requests that result in no patient contact at all, often because a passerby sees a car slide off the road into the ditch, calls 911, we automatically get sent, get there, and the person's fine, there was nothing wrong, and so on and so forth. So yeah, in some of those instances it does tie up resources a little bit, but again, part of the ambulance service and part of how we structure our organization is we really structure ourselves for what we refer to in our industry as the cost of readiness, or the readiness, the ability to respond to a request without really knowing when those requests are going to come in, because we don't know. But we have to staff and we have to position enough resources in the marketplace in order to ensure that when a request comes in, or 5 requests come in, there's enough resources available in order to respond to those requests when they come in. So there is a lot of, in our business, there is a lot of expense associated with what we refer to as that cost of readiness. It's having that ambulance staffed and equipped, sitting at the station, ready to go when a call comes in. And again, because we can't predict when those calls are going to come in, we still have to have that resource sitting there and available to the public when they need it.
Sure. So when someone does call 911, it's an you automatically send an ambulance.
Yeah, if the request is for medical assistance, then yeah. Now, in addition to that, we work very closely with all of our communities. So if one of our local fire departments goes out on a fire, a house fire, or some type of a structure fire, the ambulance is always dispatched with them. We go there, and if there's nobody there that's injured, then our presence there is to support our local fire department and their personnel, because they're obviously involved in a very aggressive activity, and so we're there to support them as well as our local law enforcement. Often we'll get a call for to stand by because there may be a barricaded gunman or some type of law enforcement issue that may be occurring within a community. And again, we're there not just for the people involved, but also for the responders as well. We're there to provide them with protection and safety as well.
Yeah. So how long does it usually take for an ambulance to arrive?
So it really varies. It depends on where you're located. When you get into the more rural areas of the county, for example, the CAPACs and Yale areas, those are pretty rural areas. But generally speaking, it takes on average about 4 to 7 minutes in most areas from the time we get the call. Now again, there's always going to be some time lapse because someone's going to dial 911. That's going to the central dispatch center. Then the central dispatch center has got to screen the needs of that caller to determine if it's a medical or a law enforcement or a fire matter. Then they pass that on to the appropriately responding agency. Sometimes that can take a couple of minutes. So often we'll get to a call and someone will say, well, it took you a half an hour to get here. What took you so long? And we go back and we look at it. In reality, it took us like 6 minutes to get there. But generally speaking, from the time we get the call and know that there's a need, we can have a truck there usually within 4 to 7 minutes. In the rural areas, sometimes 11 to 12 minutes in some parts of the county.
Yeah, but still, that's good.
It is pretty good.
You know, in a true emergency, I mean,
Right.
you know, we all know that if you literally are on the floor doing CPR to somebody,
It seems
1
like
minute
forever.
is, you know,
Yep.
an hour.
It does.
You know?
There's no question. Time kind of becomes irrelevant, and it just seems like forever for help to get there. I've been in that situation myself.
I think your response time is very, considering, you know, the vastness of the county, I think that's pretty good.
Well, and to that end, if I could, you know, one of the reasons we have those good response times, while I mentioned earlier where we have ambulances stationed, so that's where the ambulances are when there's nothing going on, there's no calls to go on. But typically what we do in our service area is, for example, I'll use the trucks in Clay Township and Ira Township. If the Clay Township truck goes out on a call, the Ira Township ambulance is moved to a point somewhere halfway between those two communities so that we can still provide good response time to both communities until that ambulance returns after treating the patient and transporting the patient to the hospital. So we call that system a system status management. So often what you'll find is you'll see citizens will drive by a street corner and they'll see an ambulance sitting on the street corner or in a parking lot, and they'll wonder, what is that ambulance doing there? What that ambulance is doing is it's covering that area, and that's not their normal station that they're assigned to. But again, because activity is going on in that particular area, we move trucks around quite a bit in order to get them into a central staging area so that we can provide good response times to that entire region and not just to the township that they may be assigned to.
Yeah, and I think that those holding areas, you know, if you live anywhere near those, you know where they are.
Oh, absolutely.
You
They're the same locations
Yeah,
pretty much
yeah.
everywhere. And those are, you know, those were very strategically selected because they are halfway between this township and that township. And
Yeah.
so it allows us to provide good response time and maintain those response time standards.
Yeah. So what is the difference between emergent care and somebody that truly needs to go to urgent care?
So typically the way we would define urgent, you see a lot of urgent care facilities
A lot.
coming about right now. And you know, really, if you think about it, there kind of are three layers of facilities in which you can be treated at. Often people will go to their doctor's office, they'll make a doctor's appointment, and they'll go to their doctor's office, and that's one level of care. Typically, those are not cases that are in any way life-threatening, but they have an appointment, and so they go because they've had a rash or they've had something going on within their body that has been troubling them. The next level is really the urgent care, because urgent care is kind of a step a little bit higher than a physician office, and they're kind of geared more for something that happened. It's not life-threatening, so we wouldn't encourage people to go to an urgent care for anything that may be life-threatening. But those are, you know, they're able to treat, you know, somebody maybe they've got a sinus infection or something a little more serious, can't get into their doctor's office, maybe it's after hours of the doctor's office, and so urgent cares tend to provide a little bit more accessibility for people. You don't typically need an appointment for an urgent care, you can kind of walk in. And then the next level would be the emergent care, which is really, typically those are the hospital emergency departments. Those are places you'd want to go if you are having some type of life-threatening situation or you know, issue going on, and so that's kind of how we break them down separately. Ambulance services are not actually allowed to transport, you know, from a residence to anywhere except a hospital. We are not allowed to take people to urgent care right now. And the reason for that is because most urgent cares are not 24/7 operations. Many of them will close in the evenings and overnight. Same thing with doctor's offices. And so the law really prohibits us from transporting patients to those facilities because we never know whether they're going to be open or not, where a hospital emergency department is open 24 hours a day, 7 days a week. And
Right.
so that's
And we all know that in the current situation is our ERs are just, they're packed. I
They
mean,
are.
Yeah.
They are.
My daughter-in-law was saying that, you know, she's at a hospital where there's 55 beds and there was 183 patients.
Yeah, the hospitals are incredibly overwhelmed right now, and I think one of the greatest challenges that we find right now, or the hospitals find right now, is often in communities like St. Clair County, a lot of our hospitals will, from time to time, depending if you have a really very serious illness that perhaps can't be treated properly locally, often you may be transferred to another hospital that provides a slightly higher level of care, or a higher level of care to be able to treat you. And right now what we're finding within our hospitals is that those hospitals that would normally accept those patients are not able to accept them because they don't have capacity either. And so a lot of those patients are staying locally, which is increasing the amount of decreasing the amount of bed availability locally. That, and you combine it with the coronavirus activity, which is very high right now, that is compounding the problem as well. And then add on staffing concerns. I think every employer is struggling with staffing right now, and healthcare is no different. Healthcare organizations everywhere are struggling right now with having adequate staff to meet the need that they have.
Yeah. So we touched a little bit about why emergency rooms are so backed up. Not every hospital has a trauma center, correct?
Well, in Michigan, every hospital is required to be designated as a trauma center. However, there are different levels of trauma centers, and so that's kind of an important distinction. In St. Clair County, we have 2 what are called level 3 trauma centers and 1 level 4 trauma centers. So if you have a very critical patient that has a very traumatic injury, it's very likely that patient is going to be transferred to a level 2 or a level 1 trauma center for treatment. And the reason for that is the level 1 and level 2 trauma centers are typically geared up a little differently than the level 3 and the level 4s are. Level 3s and 4s can treat trauma. I don't want anybody to misunderstand that, but often if surgical intervention is going to be required, or certain types of surgical interventions that may be required, that require a specialist type of surgeon, often those are not available locally, and those patients would then be transferred to the more appropriate facility for treatment.
So a level 1 trauma center is the most critical,
Yeah.
right? Somebody, cut their arm off. Somebody, was a severe car accident, having a massive heart attack. Would a heart attack be,
Heart attack is not really classified as a trauma incident. And I would say, heart attacks, cardiac care available here in our county is extremely robust. And so we have very good cardiac care, number of physicians and cardiologists that practice here in St. Clair County. So I don't think we would typically see the cardiac patients being transferred necessarily because we do have a pretty strong cardiac program here in all of our facilities. But trauma is a more difficult level of care, and I think the reason we don't have the higher level of care up here is because we don't see that much trauma. You get into the more urbanized area like Metro Detroit or Pontiac or some of those areas, they're experiencing a whole lot more trauma in those higher populated areas. And so you're going to see more trauma services that are available in those areas than you will in the more rural areas like St. Clair County.
Yeah. So level 1, level 2, they would probably have, obviously, they were going to have, OR available.
Absolutely. And we actually have OR available and trauma surgeons here in St. Clair County. It's just that when you get into, head injuries, neurological injuries, things of that nature, which often you find with trauma-related cases, specifically through auto accidents and things of that nature, that does require a specialized type of neurosurgeons, and we don't have neurosurgery up in St. Clair County. We have neurologists, but we don't have neurosurgeons, and so those cases would typically be referred to a level 1 or level 2 trauma center for treatment.
So if somebody, one of your ambulances gets onto a, bad car accident, and they know that the person needs to go to a level 1 trauma center, where do you go?
So we have the option through protocol. We can reach out to our local hospital and say, essentially by radio while we're still on the scene or maybe still extricating the patient from the incident, and say, this is the situation we've got. We'll speak directly with the emergency department doctor, and based on our assessment and the doctor's interpretation of our assessment, he may or she may direct us to that level 1 or 2 trauma center right from the scene, and we would not even go to a local hospital. For this area, the closest level 2 would be McLaren-Macomb and Henry Ford-Macomb in Macomb County. To many of the communities down in the downriver area, Marine City, Elginak, Clay Township, it may be more appropriate for a critical trauma patient to go directly there rather than go to a local hospital first and then perhaps be transferred later. And so typically that's what we do. I would say probably 35–40% of the patients we transport out of the downriver area actually go directly to one of those facilities already, and they're equipped to treat those types of illnesses and injuries.
Yeah. So you would probably go out. You obviously have to go out of the county then.
Absolutely, we go out of the county all the time. I would say probably between going directly with critical patients to if one of our local hospitals has a critical patient they want transferred to another hospital in the Detroit area, we would handle that for them. We obviously handle all the 911 business here in the county, but we also do all of the interfacility business as well for the county. So if a patient is critical, they happen to be in one of our local hospitals, but need to be transferred for further care to one of our Detroit area hospitals, then we would be transferring that patient as well. We go out of the county probably on average about 6 to 8 times a day, transferring patients.
Can you be refused an ambulance ride to the hospital if you're deemed fit to drive to urgent care?
Can we refuse you? No. By law, by Michigan law, if you request ambulance service, we are obligated by law to provide ambulance service to you. However, you can refuse to go. If we get to the scene and we assess you and you just don't want to go, you always have the right to decide for yourself whether you want to seek medical treatment or not. As I said earlier, the only time that would be an issue is if you were unconscious or if your condition was so severe that we would deem that not getting treatment would cause significant harm to you. Then there are some provisions that would allow us to take you against your will. But I can tell you in my 44 years of service, I don't know that has ever happened in this county. But the law does allow for it in certain extreme circumstances.
Yeah. How are ambulance services funded?
So ambulance services are funded by a variety of ways. There really are 3 models, and this is an area that we're spending a great deal of time right now working with our local community leaders right now in our organization. But there are really 3 models, and I'll pick on the model that we use right now, and that is we are 100% fee for service. And what that simply means, it's really not any different than a grocery store. If you go to the grocery store and you buy a carton of milk, you take that carton of milk to the checkout counter and you pay for it, and then you take your carton of milk with you. Ambulance service is really no different. We provide a service. You call for an ambulance service. You may call 911. We come, we provide that service. We take you to the hospital and we bill you or your insurance companies. In most cases, we would bill your insurance company directly, and then whatever payment the insurance company covered would be the payment that we would receive for that service. The second model that is pretty common out there right now is a combination of fee for service like we do, but also some type of local government assistance, so a subsidy or a local millage. And then the third form is 100% tax funded, where the ambulance would not bill for any services to the user or to the insurance company. 100% of the cost of the ambulance service would be covered through local tax dollars, much like a police or fire department is covered today. One of the greatest challenges that we have, and I sort of touched on it earlier, what costs ambulance service a great deal to operate is that cost of readiness that I mentioned earlier, in that at any given point, I may have all 9 of our ambulances sitting in their station not doing any ambulance calls. Well, in a pure fee-for-service operation like we have right now in this county, we're not generating any income. All of our costs still exist because I still have those ambulances there. I still pay the people. All the equipment is there, the utilities, the facilities. We still maintain all those costs, but there's no revenue coming in to offset them. Again, the only time we generate revenue is when we do a call. What we're finding right now within our organization is the cost of all of our labor, and labor costs have gone up significantly in the last 6 months. But all of our costs are rising much faster than our reimbursements are rising. And so quite frankly, we began this past summer approaching our local communities and quite frankly the County Board of Commissioners, and we've kind of told them that we're going to have to find some additional funding in order to support the cost of operating the ambulance service that we operate. And so we're still looking at that. No final decisions have been made, but what I think we're going to probably end up doing is coming to the voters, the citizens of the county, and asking them if they would consider supporting a local millage that would help, essentially would offset some of the losses that we're projecting that we're going to be incurring here in the coming years. And that would really provide a safety net, if you will, for ambulance service in the county. By having some supplemental income, it would allow us to ensure that the citizens of this county are going to have safe, reliable, high-quality ambulance service for many, many years to come. But if we don't do that, regrettably, we're going to be forced to cut in order to pay our bills. And that may lead to a reduction in services in certain areas. Obviously, we don't want to do that. It's not something that we recommend, but we have to pay our bills. And if we don't have enough revenue coming in and the costs are rising faster than those revenues, then we really don't have any choice but to do that. So, big issue.
I think that the average person doesn't realize that, having an ambulance company like you have, it's a business.
It is.
It's a business. It's like any business. I don't care if it's a factory, if it's a restaurant, if it's a retail store. When your goods and services go up, and you want to, well, yours is a little different because of the educational part of it all. You have to have trained professionals.
Correct.
You're not paying anybody minimum wage to,
Yeah, you don't get people for minimum wage anymore in our business. And just an example of that, Cheryl, I don't think people realize how expensive ambulance service really is. I mentioned that we have 9 ambulances on duty 24 hours a day. Well, to support those 9 ambulances, all of the equipment, all of the personnel costs, all of the insurance costs, all the supplies, the facility, everything that takes, all that overhead cost that it takes to provide that, it costs us about $750,000 per year per station to operate. And
per station.
Per station.
Times 9.
Times 9. So it is incredibly expensive to provide that service. But, I think that if you ask most people, I think that they have that expectation that their community has ambulance service. And one of the interesting little sidebars I would point out here is that in the state of Michigan, ambulance service is not considered an essential service by law. So Marine City is not obligated by law to provide ambulance service to its citizens because it is not deemed an essential service. And so, and I think if you were to ask any citizen in Marine City, they would tell you, well, sure it is. It's an essential service. If I am having a heart attack, if I get in a car accident, I expect an ambulance to arrive. And we certainly agree with that. And we have obviously positioned ourselves to be able to provide that. But I thought it was kind of interesting when I did a little research and I discovered that it's not an essential service, and yet you would think it should be an essential service.
What is an essential service?
Well, typically in some areas, police coverage by law, by definition of law, is considered an essential service. You must provide that. And I think in some areas, in some structures, municipal structures, fire service is also essential, but in some it's not. And so I think it's really weird and strange when you do the research on that. I think when you ask the public, they would tell you that, well, sure it is. It's an essential service. If I have a house fire, if I have a chest pain or I have a heart attack, I expect those services to arrive. And I will say that in this community in St. Clair County, those services are provided and they're treated as if they're essential, but by law, they're not required to be essential, or they're not essential, not required to be provided.
So let's flip the coin.
Yeah.
So we don't have an ambulance service now, right? So who's going to roll on, who's going to come to my house if I'm having a stroke or chest pain, or if I sliced an artery or something like that? Who's going to show up?
So it all depends. I think that the responsibility, even though it's not required by law, I think the responsibility will probably rest with the local unit of government to provide that in some fashion. So I guess it would be the challenge of that local unit of government to reach out to see if there's anyone else that would come in and provide that. More than likely in that scenario, you're going to probably have to rely on the next closest ambulance, which unfortunately here may be coming out of Richmond, or it may be coming out of Clinton Township. And those obviously are time frames that you can't wait when you're having those types of medical emergencies. So I think the appropriate thing to do is to address the concern so that we don't have a loss of service. And that's certainly what we prefer. I want to emphasize to your listeners, we're not unstable right now, but we are speaking to our local leadership right now before we become unstable, and trying to address the issue proactively before we're faced with the issue and have to start looking at making cutbacks. So we have about a year or two before we feel that it's going to be a desperate situation. And so I am incredibly confident that our local unit leaders like yourself will work with us. Our County Board of Commissioners is working with us right now and has been incredibly supportive. Nobody wants to see our ambulance service and, quite frankly, Tri-Hospital EMS go away. They're very happy with it. They're very satisfied with it. And the response I've received from our local elected officials is, look, we got to do whatever we need to do in order to ensure ambulance service for our citizens for the future. And so that's a very positive reaction, and one that I'm extremely confident will get resolved.
Yeah. Because your service is one of those types of services like, police and fire, where if you don't need it, it kind of goes in the back of your head.
Yeah.
But then when you really need it,
you need it.
You need it.
Yeah. In fact, statistically, I will tell you and your listeners that every person will use an ambulance at least once in their lifetime. That's an average. Some obviously won't ever use it. Some may use it more than once. But I have to tell you that if I'm the one that needs it, I'd sure like to know that the one that's coming is good, high quality, and has well-trained people,
well-trained personnel,
and very stable. And am I willing to pay extra for that? Absolutely. I may be a little biased because of what I do for a living, but I would say the same thing about my police department and my fire department. I want good, well-trained people that have the knowledge and the skill to take care of my need.
Yeah. I've had good experiences and I had one bad experience. My bad experience was in another state. And it's still, I can still recall that, very clearly. I'd much rather have somebody in the back of that rig with me that's going to talk to me, make me feel calm, tell me exactly what they're doing. Training is huge.
It is.
It's huge.
And I will tell you, and I will confess that right up front that I am a little bit biased, but we have an incredible, talented group of people that provide service. Many of them are people who live within our community, and they're incredibly dedicated. They're very, very skilled in what they do. You don't just walk in off the street and work for an ambulance company. There's an enormous amount of training that goes into it. And these are very passionate people about what they do. And The other thing I would just say is this is a hard job. This is not an easy job that they do. And you know, in the news last week, we had a family that drove into one of our local rivers in Port Huron, and we removed, the fire department, Port Huron Fire Department removed 4 people from the icy waters of the Black River. Our people treated those people. And today, 3 of them are still alive because of the interaction of both the fire department getting them out of the water in a timely fashion and the partnership of Tri-Hospital EMS and our personnel treating them and transporting them to the hospital and the care that they received at the local hospitals. I mean, it's a joint team effort that everybody participates in, but this is hard work. This is not easy work, and it is, but it's incredibly important that it be available to the public.
And I think people need to know that, you know, when you do call an ambulance and somebody comes, you know, they're working a long shift.
They are.
You know, and you know, they could just have come from another, you know, critical accident. God only knows what they see, you know, what they're dealing with. And I think it's important that, you know, that we are really clear to, you know, what our needs and requests are in the back of an ambulance, and you know, because they're there to help us. You know, we have to let them know what we've got going on, what medications we've taken, you know, all that kind, where we would like to go, you know.
Yeah, and I will tell you, you know, the hospital that you go to is always your choice, except when your condition is life-threatening. Michigan law requires us to take you to the closest appropriate facility in those situations. But most of the time, you choose the facility you go. And you know, if there's ever a complaint that we get from patients, it's that, why did they ask me all those questions about my medical history and who my doctor was and all those things? What the public needs to understand is we need that information in order to treat what's going on with you. Because if we know that you have a history of heart trouble and you're having chest pain right now, and maybe you had a heart attack 3 years ago, or you had open heart surgery, or whatever it is, it's that information that helps us clear the picture up for us, so that we've got a good understanding of, you know, what your symptoms are now, what your past symptoms were, what your past history was, and then we can create an action plan for treating you before you ever get to the hospital. And in most cases, we can have you stabilized in the back of the ambulance before you ever get to the hospital. And that's really the whole strategy of what it is we do.
And those questions are important too, because you know, that information is being relayed to the hospital, right? So when you get into ER, you know, the emergency room, you know, for whatever it is you're presenting with, they're ready for you.
That is absolutely correct. All of those questions, all of that information that we're asking of the patients or assessing the patient, the blood pressure, you know, all of the cardiac monitor, whatever rhythm their heart is showing on our cardiac monitor, all of that information is being communicated by radio to the ER physician before we get there, so that they can be prepared before we ever get there for our arrival. And so, yeah, it is very much a team effort on the part of all the participants.
Right, because timeliness is, you know, is everything. I mean, look at what's called the critical hour when you're having a stroke, right? I mean, if somebody is showing stroke-like symptoms, they have 1 hour. That's not a lot of time.
Yeah, you're right, and that goes to what I said earlier about, boy, when you start feeling that numbness, when you start feeling the dizziness, and you just know something's not right, you need to call right away, because the faster we can get you the proper treatment, the less likely it is that you're going to have long-term residual effects of that. And we have excellent stroke and cardiac care right here in our county through our local hospitals. And they are able to administer treatments in the emergency department that can literally prevent some of the side effects of stroke that we typically would see. But again, the longer you wait, the more likely it is that you're going to, you know, those effects are not going to be reversible or correctable. The sooner you call, the more likely it is that you won't have to suffer those. Not always, but in many instances.
Right. That's why I think it's important to clear up the difference between emergent care
Right.
and urgent care, because you certainly don't want to be tying up, an ambulance service, with something that Tylenol could clear up. If you have,
Right.
you're spiking a fever or, whatever, you got to be able to take yourself into urgent care and leave that ambulance at the ready for, obviously the critical things, emergent care.
Yep, absolutely.
Yeah. Yep. If the community does not support additional funding, what will happen to our ambulance service?
Well, if we go to an election, which we support, we believe that we should give the community the opportunity to say yes, we want to support our local ambulance service.
You're talking a millage.
A millage,
Yep.
correct. If we were to go that route, if the voters for some reason decided they didn't want to support that, then I guess our next course of action would be to come to each individual community that we serve. So in your case, I would probably come back to Marine City and say, here's what we're going to need from your community in order to provide service to your citizens. And I don't have the dollar amounts right now, but that then would probably force your community to take away from other services that perhaps you're providing for right now in order to provide whatever assistance it is necessary to do that. We hope we don't get to that point. One of the things I did early on when we first realized that this was going to be an issue much earlier this year is I actually went out and I met with the communities. I met with the township supervisors. I met with the managers, the mayors, and I said, what would work better for you guys? Would general fund allocation out of your current budgets, or would a countywide dedicated millage be more appropriate? And many of them felt that the millage would, actually all of them felt that the millage was a more appropriate avenue. And I think one of the reasons was not so they didn't disturb their budgets, it was more, a millage would be a more stabilizing method. Township government, as you well know, they have fluctuations. They have needs that come in, and some years you have a fund balance, other years you dip into your fund balance. And where with a dedicated ambulance millage, that money is going to be there every year, year after year. And it's going to provide a safety net to the citizens of St. Clair County. And to be honest with you, Cheryl, I don't think we're talking a huge amount of dollars per person. I mean, the types of estimates that we're looking at are probably somewhere around $25 to $50 a year in an assessment, somewhere in that ballpark. And $50 a year is not all that unreasonable to ensure that you have emergency ambulance service 24 hours a day, 7 days a week in your community.
That's exactly right. Because you had mentioned the statistic, and I just want to repeat it. Right, $700,000 per station.
Per station.
Times 9.
Yeah.
Do the math.
It's pretty expensive.
That's a lot.
It is.
Yeah. And I think that you mentioned the word millage, and some people just start going, oh my God, it's, more money. But in today's day and age, especially with everything changing and the cost of doing anything, goods is increasing.
It is. And that's really, I don't mean to interrupt you, but that's really what's driving this for us is, quite frankly, our labor costs have gone up 24%. In order for us to recruit people and to keep the people that we already have right now to ensure coverage, we've had to increase and adjust our wages up 24% since October of 2020. Sure. Fuel costs. My fuel costs right now are through the roof. We travel
imagine.
We travel a little over 1 million miles a year in our entire fleet, and the price of fuel is just strangling us right now.
And I'm sure you have standards as far as keeping are the trucks constantly running? Well,
not if they're in their stations. But given the amount of call volume that we're doing these days with some of the coronavirus activities and things, we're pretty much going almost all the time. It's pretty unusual for a truck to be actually in its station right now. They're on the road transporting patients pretty much all of the time right now.
Yeah.
Our overall utilization through a 24-hour period has gone up significantly in the last 3 or 4 months. But That isn't always the case, but right now it is. And so, obviously with that amount of activity, it increases the costs and the wear and tear of the vehicles, the miles that are going on, the maintenance that goes into it. We have a very aggressive vehicle maintenance program to ensure that our vehicles are always going to be at the ready. And so all of those cost money. And I hate sharing that with the public, but it's a reality that we're facing. And again, what I would just simply say is the amount of dollars that we collect, we are not like your local grocery store. When you look at the way healthcare is reimbursed in the United States, I can't just raise my rates. I can't charge more because the amount of money I get is a fixed amount. I don't get any more if I raise my rates. And so there's no option for us to increase the funding except to go to the communities and say, can you help supplement the losses that we're incurring? And that's the difference between us and a typical business. If the cost of that milk, that carton of milk goes up, the retailer passes that cost on to the consumer, and they pay more for a gallon of milk. I don't have that option because the payer does not pay us anymore, and so we're pretty much on the hook for it.
Yeah, and you have to keep educated, professional employees.
Absolutely.
I mean, you run a critical service.
Absolutely.
And you get what you pay for.
You absolutely do.
You get what you pay for. I mean, if you can. You're not an ambulance driver.
Yeah, and that's not an area that, as the CEO of this company, I'm willing to compromise on. I want talented people. I want qualified people. And I think the public, when we respond to them, expect the same thing. And they should. They should not expect anything less.
Yeah, I agree. Anything else you want to tell us?
No, you've been very thorough, and
we've covered a lot of ground.
Yeah, and it's been great. I enjoy talking with you. And certainly any time that the commission has any questions or would like me to come, I'm more than happy to come and address the commission as a whole or any of the citizens. We're a pretty open organization, and we're proud and honored to have the privilege of serving the citizens of Marine City and the surrounding communities. We do cover, as I said, with all those stations, we cover the vast majority of St. Clair County. We do cover 28 of the 30, I think there's 32 or 33 municipalities in the county. So we're doing about 20,000, maybe 21,000 requests for service per year that we're handling. So we're pretty busy.
With 9 trucks.
Yeah, they're pretty busy staff.
I was actually kind of surprised at that number. I thought for sure you were going to say more.
Yeah.
I mean, because this is a big county.
It is.
And it's like, we talked about it before, it's 40 some miles from tip to tail. I mean, that's a lot.
It is.
That's a lot of coverage.
A lot of dirt to cover.
Yeah,
we call it dirt, but it's
dirt too.
We have to get from point A to point B, but like I said, we've done it for 38 years. The last thing I would just share with you is, we do survey our customers, and we have an independent organization that does send out a survey and asks our customers, how did we do? And what do you think of the service? And we have, since we started that process about 10 years ago, very consistently had about a 96% satisfaction rate, 95, 96%. Consistently over all those years, that the public is very satisfied, very pleased with the service, and that's an important piece of information for me as the CEO, because I want to make sure that not only are we providing good service, but the public believes we're providing good service as well.
Right. And I think as far as funding goes, I think that a millage probably is the way to go. It just seems the easiest, the simplest, the fairest, and for usually the average millage it can be anywhere from $10 a year to like you said $50 a year, depending on the millage. But in the realm of everything, that's cheap.
Yeah,
for the services you provide, that's cheap.
I will say that as a resident of this community for most of my life, or the county, I guess I should say. I'm pretty sensitive about tax increases, but I also support those that I think are necessary and provide a valuable service to the public. and we certainly hope that the public views our service as valuable.
Yeah.
So,
Yeah, it's definitely valuable. All right. Thank you very much for coming.
thank you, Mayor. It's my pleasure.
I appreciate
Good to be
it.
with you.
My name is Cheryl Vercamman. I'm the Mayor of Marine City, and this was another segment of the Mayor Minute.